Well, welcome. My name is Adam Rubenfire, and I'm a content strategist at Modern Healthcare. I'll be moderating this webinar, Optimizing Your COVID-19 Vaccine Outreach. In this webinar, experts in patient communications and experience will offer advice and best practices on how leaders can ensure that their vaccination outreach efforts are efficient and reach key patient populations. And before we get started, we'd like to thank our sponsors, Reputation and Well Health. Reputation, creator of the Reputation Experience Management category, is changing the way healthcare organizations gather and act on patient feedback to drive decision-making and enhance consumer experience programs. Well Health is a software as a service digital health leader in patient communications and the 2021 Best in Class winner in patient outreach. Well Health's Intelligent Communications Hub is the only two-way digital health solution engaging patients throughout their entire care experience. Now, I'm thrilled to introduce our panelists for today's session. You can see them on webcam. Meg Aranow is the Senior Vice President of Client Success and Platform Evangelist at Well. Before joining Well, she served as CIO for the Boston Medical Center and Senior Research Director with Advisory Board's Information Technology Strategy Council. Annie Haarmann is Head of Strategy and Consulting for Healthcare and Life Sciences at Reputation. In her role, she partners with large, complex healthcare organizations to provide strategic consulting and data-driven insights to maximize value and drive patient acquisition. A couple of housekeeping notes before we get started. We want this webinar to be an interactive experience for you, our audience. You're encouraged to ask questions using the questions pane in your GoToWebinar attendee panel. The speakers will try to address as many of your questions as they have time for, and you can also download content from our sponsors in the handouts folder of your attendee panel. We've got a couple different pieces on COVID-19 vaccine outreach that should be really helpful. And should you need any assistance during the webinar, please don't hesitate to contact us via the questions pane in your attendee panel. Myself and my colleague Sally Zimmerman are here to help you. And now we'll begin with brief presentations from our presenters on their best practices for vaccine outreach. Meg, I'm thrilled to start with you.
Hey, thanks so much, Adam. And hey, everybody, it's a pleasure to be with you today. Adam did a great job introducing Well Health. We consider ourselves the last mile of patient communication, unifying what has been disparate messaging from provider organizations into a single conversational thread for patients. When COVID hit, we took it as our mission to serve both our current customers and those folks that were in our pipeline and talking to us already. And we did so at drastically reduced cost. We really wanted to be a part of the citizen solution for what was happening. And one of the things that we continued to do was to march with our provider partners as the situation changed and evolved and as their needs and their patients' needs changed. And so when the vaccines hit, one of the things we did was to design a fully conversational interactive pathway with patients to try to maximize the throughput and the efficiency of provider operations, at the same time reaching as many of their patients as possible. And so I've just got a few slides here that'll walk you through what that conversational engagement looks like based on best practices that we were able to develop in partnership with our customers. So I forget how many slides we have here, a couple of slides, but I think we'll show you sort of the top 6 or 8 workflows that we've strung together in order to maximize the efficiency. So we start, of course, with reassuring patients. And although we're well into the vaccine rollout now, we see that it's still a necessary thing to reassure patients, to talk about safety, to talk about the why and the how of getting the vaccine. And so our conversation starts there, which is where most provider conversations would start. We move into educating patients about availability and dosing. If they're hesitant, we reach out further with additional educational resources. Most of this is happening without the need for human intervention. We use AI to power these conversations, although we can always exit the conversation into a nurse call center or other resources available at the provider organization. You can go on to the next slide, Adam. So following that, once folks have indicated that they're interested in the vaccine, we go into what is our normal cadence of appointment confirmations and reminders. We maybe add a few extra reminders. That's completely up to our provider partners, but just to make sure that patients understand where they're going, how to arrive, what to bring with them, et cetera. All of that can be embedded in these conversations. And then after each dose is administered, the first or the second, if you're getting 2 vaccines or administering 2 vaccines, we do have a conversational bot that reaches out to check for reactions, to provide reassurance if those reactions are those that would be typical, such as soreness in the arm, but also to provide one of those off-ramps that I discussed to a nurse call center or to a provider if a patient indicates that the symptoms are maybe some of the more severe symptoms that might require some intervention or at least some reassurance directly from a provider. You can go on to the next slide, Adam. Second dose, we have considered, and I think it's well documented at this point, that to schedule the second dose, it's best to do it at the first dose while the patient is right there with you. If that's not possible, we do have part of our conversation that can reach out quickly, really as soon as the patient leaves the facility or any time thereafter, to get that second dose scheduled. We have not seen from our patients the significant drop-off. And when I say our patients, of course, I mean our provider partner patients. We haven't seen a significant drop-off in terms of second dose, but we're always aligned to the expectations that the providers want to ensure that they're guarding against that. For those times when there is a no-show, or even if there is a refusal, we do have automated conversations that engage more deeply with the patients to understand why they missed the appointment or why they may be hesitant about the appointment, so that we can provide additional educational material, perhaps have personal touch with a care provider actually reaching out. But everything that we can do, again, sort of minimum burden on the healthcare staff, but to try to engage those patients to make sure that they come back in. And then I think we've got one more slide, Adam. Part of the other thing that we do is that we assist in any way we can. We cannot fully satisfy the information reporting requirements that our provider organizations have, but we can participate by contributing the data that we do have for those things that were achieved via our system. Of course, providers have other systems at play, EMRs, other types of information, some inventory systems for their dosing, et cetera. But we are a participant in that and do what we can to ease the burden in terms of reporting. And then more lately, we have been talking with our partners about the need to create a waiting list for extra dosing vaccine. So that, of course, wasn't an issue in the beginning, but as we've progressed along the trajectory, it has become more of an issue. And so many of our provider partners are now working to make sure that when slots do open up because of no-shows or for some reason there's extra vaccine, that they have a list that they can contact and reach out to make use of those doses as efficiently as possible. So as things continue to change, we will continue to evolve with our partners, but that's our standard workflow. Thanks, Adam.
Excellent. Well, thank you so much, Meg. Appreciate that presentation. And I want to go to Annie next, but audience, as our presenters get through these presentations, if you have any questions about what they're saying, please do send them to us. And right after Annie, we're going to get into some panel Q&A, and we'll take your questions along with some questions I have for our panelists. So Annie, I'll go ahead and give you the floor.
Thank you, Adam. And just a little introduction about who we are here at Reputation. We established the online reputation management category back in 2006, and we've been helping healthcare brands to improve their online reputation and consumer experience ever since. We partner with some of the leading technology companies, as well as being invested in by some of the most important healthcare investment partners that are out there today, such as Ascension Ventures, Heritage Partners, and some others. If you go to the next slide, Adam, I want to level set where we are in terms of an industry and help to sort of frame the conversation for how we are analyzing consumer sentiment around the coronavirus vaccine. And that might help to educate some of the ways that you are out there bringing in patients and getting that community fully vaccinated. So we know that healthcare has changed and it's really being driven by consumerism. And our recent consumer healthcare study that we did through a third party found that the vast majority of healthcare consumers trust online ratings and reviews. And in fact, it was the number 3 factor when it came to making a decision about their care, right behind location and insurance provided. So it is absolutely an important factor when people are looking at where they might need to go to get vaccinated or to reassure them that vaccination is the right choice for them. We know also that Google is the number 1 review site used by healthcare consumers. That is by far. And not only is that what consumers indicated to us, but it's also what the data would indicate. There is a vastly larger amount of healthcare reviews happening on Google than there are on any other platform. So this is the framework and the lens through which we are looking at how you should be communicating about coronavirus and the vaccination. So Google owns this entire consumer journey. And I'm sorry to say it, but all of the investment in our website is not going to do any good until we actually own that Google experience as well, because Google is going to intercept that traffic. So they're going to do a near me search. They're going to see these results, and increasingly they're able to take all of the action that they need to from right there in the Google panel. During the initial stages of the pandemic, as healthcare had to shift to a virtual care option, they added that as an attribute from right there in the knowledge panel. And so consumers could start having a visit right there. Now they are looking at adding tags for coronavirus vaccinations. What's available at this location? Who are they vaccinating? Who is eligible? And this is in alignment with Google search trends today as well. And if you go to the next slide here, Adam, I want to start by looking at the search trends related to vaccines in the US. So as you can see, the consumer searches related to vaccines saw a dramatic increase around December and into January. And then they saw an increase again in March. These searches continued to remain very high until around April. And so for the last 4 weeks, what we've seen is that there has been a steady decline in the searches around vaccines since then. Now, it's only been a few weeks, so it's too soon to extrapolate the cause for that decline, but there are a number of possibilities here, including an increase in the availability of the vaccine through primary care providers. As Meg mentioned, they are communicating directly to patients. There are some best practices here that are starting to be adopted more. And so it's possible that consumers are getting the right information from their primary care providers and their healthcare brands that they are already connected to, and they are having to do less of the research on their own. But again, this is just an observation, and this is what we're seeing in the data. If you go to the next slide here, this was some interesting information that I found using Google search trends data, and this is for this past week. So this is really timely, May 3rd through the 9th. And these are the top 5 questions that consumers are asking on Google related to coronavirus. There are plenty of other questions they're asking, but these are the top 5 related to the coronavirus vaccine. And this tells us more about what consumers are confused about and what kind of information they're trying to get. And as you can see, some of them are still questioning the most basic facts around the vaccine. The number 1 question is the COVID vaccine FDA approved? We would hope that they know this already, but because of all of the misinformation that is swirling here, it's something that consumers are still asking. And if you'll notice, 2 of the 5 questions are about which vaccine is better or best. And this is a consumer behavior that really illustrates where we are as an industry. We are now in a feedback-driven industry, and people aren't simply going to the one that is nearest by, or the one that they were told to go to, or the one that they were referred to. They actually want to choose which vaccine they want to get. I mean, imagine, years past, if a consumer had been shopping for what flu vaccine they should get. No one did. We didn't even care about the brands. But because there's been so much education around this, consumers want to choose. They want to choose which vaccine they get. And that is really evident in the searches that are happening online. So now let's talk about what kind of feedback we are seeing after the fact. So after the consumer has had that interaction, some sort of clinical interaction, whether it's getting vaccinated, getting tested, whatever, we are seeing that the review trends are trending higher. So consumers are having better experiences. And this chart shows quarter by quarter over the past year, consumer sentiment is improving. So we started out, it was less than 3 stars. It was a 2.9 out of 5 stars for the average of the experiences that people were having that mentioned COVID-19 or related terms. And this makes sense because, over the past year, we had some challenges. At first, it was we didn't have enough testing, or the protocols weren't communicated effectively, or consumers just weren't ready for it. And now we see that has moved up to a 3.5. And that tells us that the experiences are not only improving, but also the expectations for consumers, I think, are more in line with what they should be expecting. They expect to be waiting in a socially distanced waiting room. They expect to be asked to wear a mask or to have their temperature taken. So we've done a good job of starting to get used to this new normal, and that expectation is now aligning with the reality and making it more likely that it is an expected and positive experience. This next slide is specific to the vaccine. So, this is newer data. Vaccines have been around for just the last few months here. But what we are seeing is that compared to the previous quarter, the Q1 data tells us that there are 16 times more mentions of the vaccine in their experiences than the previous quarter. So this is definitely a critical part of the consumer experience, the vaccination experience, and we're seeing that it is generally a positive experience. So 4.5 out of 5 stars for any type of healthcare experience is very good. And when it comes to vaccines, what we're seeing is that that is, it's much higher than what their general experience might be for any healthcare interaction that they're having. So it is very positive to see these findings and that people are having a good experience. So finally, I just want to leave you with a few best practices based on the data that we have been tracking. First and foremost, you have to optimize your local search. As I showed before, consumers are turning to Google. It's the #1 place for them to learn about what other people's experience has been. So you've got to claim and actively manage your online listings. The second piece is answer questions. As Meg mentioned, there are lots of questions being asked. You want to make sure that you can inform and provide a consistent story, even if it's an automated story. You can work through Google Messages to provide a workflow that answers questions around coronavirus. And then if it gets to a point where they need to be transferred to a nurse, that's something that is entirely possible. The other thing you need to do is ask for feedback from all experiences. One of the things that we noticed early on is that as healthcare systems ramped up their virtual care, they had feedback coming in through a different channel. Maybe it was living in the platform for that virtual care experience, or maybe it was being collected separately, but it wasn't being collected into a single place like the in-person visits were. And as virtual becomes the new normal, as we've all gotten used to calling it, even if it's reduced in the number of visits, it's still going to be something that we are doing for the long haul, and we want to collect all of that feedback. The other reason to be asking for feedback for these virtual experiences is that those ratings and reviews are going to improve your SEO online. It's going to improve your Google My Business ranking and prominence. And unless you ask for those reviews with virtual experiences, you're not going to have as much volume as you did previously when every experience was in person. Combat misinformation, we know that this has been a huge challenge, and our recommendation is to get out in front of it before it becomes an issue. And one way that you can do that is to monitor your online chatter, monitor social to see what the trends are. Look at Google Trends, see what consumers in your region or your community are searching for. You can tell where things are in terms of information, what people are still confused about, and then you can use that information in your future marketing and get ahead of it with proactive storytelling and testimonials on your social channels. So those are some ways that you could take action now, and I'll turn it back over to Adam for some more conversation here.
Excellent. Well, thank you so much, Annie. Thanks to both of you. Audience, you can see we've got two folks who are talking about outreach here, but from unique perspectives, reputation, reviews, as well as communication and really how to engage patients. So we're really excited to get into Q&A. I've got some questions here, and we've got plenty of questions coming in from the audience. Audience, continue to send in questions. We'll take them for as long as we can, and our sponsors are going to get these questions after the fact, so they want to know what you what challenges you have and what questions you have. So please feel free to send those. But I want to start big picture and kind of where are we now question. So according to the latest data from the CDC, just pulled it, over 34.8% of Americans are fully vaccinated, and about 46% have received at least one dose. I'd love to hear, starting with Meg, what your thoughts are on how far we've come, how we got here, and what lies ahead. Just over a year ago, we had no vaccine, and the virus was new. So Meg, where are we now?
Thanks, Adam. Well, that's an easy question. I'll get back to you in the next few hours on that. So yeah, big picture, I'd say it's easy to point out the mistakes, right? And I'm a television addict in terms of online news 24/7, and so I hear it constantly in a loop. But I'll also say it's kind of amazing what has been accomplished. We really started from a pretty depleted place. You've probably heard we were sort of pulling back on what we were doing with the World Health Organization. I think, and I'm coming at this from a public health point of view. It's my background, I think in the US, we dismantled some things or really sort of just let some things atrophy over the years. So we really weren't even starting from a level playing field. And so I think we did a lot to catch up. I think what is happening now, though, is that our messaging has to get more personal and more specialized. So we started with big mass messaging campaigns that frankly created a lot of confusion. They did a lot of good also, but there was sort of this collateral damage of confusion, right? And then the providers got more engaged and started, making more specific messaging. And now we're almost down to, hand-to-hand combat, as they would say, right? We've gotten all the people that were eager, and now we've got to turn our attention to the folks that aren't. I think we're on the right track. To sort of answer the big picture question, I think this will come to a positive conclusion. And I will just put in one plug to say this is a clarion call for us to really, and as a country, upgrade our public health system, how we think about processes, how we think about communication, and how we think about tracking. Because unfortunately, this is just the state of the world we live in today, and there will be other needs to use a public health infrastructure. So I think lessons learned will be very important.
Excellent. Annie, your thoughts?
Meg said it so perfectly. I agree with everything she said about just the idea that this is waking up many to issues that have existed in healthcare for too long, but most people just didn't realize it or saw only a small part of it. And for consumers, they didn't know why things were so messed up or so full of friction. They just felt the friction. They felt that pain. And I think that where we are as an industry is that there's been this mass wake up to the need to rely on technology and share data, because there's no way we come out of this crisis without sharing data across platforms, sharing data with consumers, educating the public. And beyond that, the conversation around some of the privacy concerns and HIPAA and all that, I think has shifted to, rather than using HIPAA as a barrier or to block our ability to communicate about these things, we're going to use our ability, our technology, to communicate to the patients where and when they need it, make sure they get the care they need, and that is so important that if we run up against some of the regulation of the past, let's do that. Let's run up against it, and then let's figure out how to adjust the regulations to meet the needs of consumers today, because we can't keep operating the way we have in the past. And consumers won't let us. They're going to expect us to respond differently from now on.
Well, and Annie, that's a good segue into our next question. So I'll stay with you for this. I mean, we're moving from appointment only to walk-in in a lot of cities. Even here in, I'm in Chicago, and we're a large city with a lot of demand, but we're still moving into walk-in. So how does that change the dynamics of how we reach out to patients? Do we have to work harder to get people in the door? I know, Meg, you talked a little bit about kind of how we can't, the mass messaging is no longer the way to do that. So Annie, what are some of the barriers to getting people vaccinated in this new phase, and how do we overcome those?
I mean, there are so many barriers, not just in the beginning, it was all about the educating the public. The public has the information now. And now it's about breaking down the barriers to that access. And from our perspective, we look at what is the first barrier that they may face. If I'm a consumer and I'm looking online and I see information for a clinic near me, I've got to have the right information, especially if you've got a rural patient or a rural situation where they might take hours just organizing the transportation to get to that facility. Then they show up and the hours have changed, or they've had to close for the day because there was some sort of a running out of the vaccine, or there was an outbreak of the virus, or maybe they're a no COVID location. Whatever that is, you've got to make sure that your first line of information to consumers is completely up to date, that you have a way to update that at scale, to manage those online listings, and to get out in front of consumers before they have those issues of, how do I spend another day getting out here when I got the wrong information initially, and now I can't get my vaccine. You've got to have all of your services updated, all of the access points, must be up to date, and you've got to be doing that in real time. The other piece of it is you've got to be able to answer questions from consumers from right there within Google. Google has given us the tools to do this. We've got Q&A, we've got Google messaging. Consumers want this. They are using these tools, and if we are not out there, then we are just leaving a huge gap when it comes to that experience, and we're making it harder for consumers to actually show up for us.
Meg, do you have anything to add on how kind of the customization of messaging changes now that we need to be a little bit more proactive and not reactive?
Well, I think Annie's points were awesome. I think right now so much attention goes to the quote unquote anti-vaxxers, but there's this whole other bolus of folks, right? That it's not that they're against it. They're issues of access, right? And so I think everything that she said was right on. And if they are a little hesitant, I hate to use that word because it's kind of overused, but I think we're past the point of talking at people and telling them why they should. And I think we need to start engaging in conversation about why. So instead of telling them, let's ask them, what's holding you back? What's preventing you? Some of those will be issues of access. And in that case, in addition to the things that Annie said, employers could step up. They can create, workplace vaccine clinics. They can help people with transportation. Other communities can step up in terms of childcare. I mean, there are a lot of reasons why it's difficult for folks who could be interested to actually get to a place where they could receive the vaccine. So I'm all for the walk-ins. I think that removes one layer of barrier right there, and then we've got more work to do after that. And I think, as you mentioned, I've talked about before, these personalized messages, engaging what exactly is your barrier, as opposed to the messages writ large coming from the government.
So, but Meg, you mentioned that kind of it's turning from, not going after anti-vaxxers, but kind of getting into the why you should get it. Is there still a need to combat misinformation about the vaccines and the virus? And do you have any thoughts on how to do that in that setting?
Yeah, I mean, there will always be that need. We can't, I guess, I didn't mean to say, like, take all your attention from one and put it on the other. It's kind of a both-end strategy, right? And I just don't want to lose track of those people that would be willing. And again, education is not just about people who are against the science of it. There's other public policies around that, right? There are people that are hesitant to get vaccines because they think they'll have to show citizenship. And if they can't, that something bad will happen, or they think they have to pay. So there's a lot of education that we can do that's policy, not science. But of course, we do have to keep up with the science. I'm not sure. I think that's sort of a dwindling return, unfortunately, in terms of, continuing to push on the science button, but we can't stop. And I think we see these startling images, right, from 1918, from 100 years ago, where it was the same thing within the context of their era, right, where there were folks that were refusing then too. And that is still a right in this country, is to refuse.
Thank you. That's a great point, Annie. I'm curious your thoughts, because I know the social media companies and Google and other tech giants have really spent a lot of time on this issue. So I'm curious if you have any thoughts on how our readers should combat misinformation.
Yeah, I think Meg said it really well when she said we've given too much attention to the anti-vaxxers, and we've got to change the narrative. We can't be reactive to the misinformation that's out there. We've got to be proactive with the storytelling that we are putting out there about getting vaccinated. And one of the things that hasn't changed since before the pandemic and now is that consumers trust physicians, they trust nurses, and in some cases we're seeing that trust has even increased since the pandemic began. And we can use that, use your physicians and your nurses as ambassadors of this move to get the entire community vaccinated. The storytelling element of this cannot be overstated here. I mean, you're combating facts with this idea that there is a different fact out there, and as we've seen, perception becomes reality very quickly. So in this case, I think the perception can also be used to help drive a comfort level and a trust in getting that vaccine by using people who they do trust. Get those stories out there. We saw those amazing news stories of the nurse who was the first to get the vaccine in the U.S., and that was so emotional. And now, I'm seeing a lot of healthcare organizations are showing photos of their physicians, their nurses, and why they got vaccinated. It's not that I was told to. It's because now I can go to my kid's soccer game and stand in a crowd, and I couldn't do that before. Let's talk about the things that we can do and why we should get vaccinated, instead of trying to react to the misinformation and the negativity that is out there, because we'll waste all of our time doing that, and we won't be able to get to the success on the other side of this.
Yeah, it may be best to take a cue from the CDC. The CDC's communications have been doing that as well. I thought they had a really great graphic of, people with masks under the things that you could do. Meg, I'm getting a few different questions for you, and I'm going to kind of bring them together. We know that we need to avoid waste of vaccines. So I'm wondering what best practices you can share for providers who are hoping to minimize no-shows and cancellations, how to respond if somebody ignores reminders or refuses to get their second dose. I'm also being asked how you've been tracking the drop-off rate after the second dose. So I'm happy to repeat. That was a few different questions in one, but generally trying to get an idea of how to respond to no-shows, whether it's first or second dose, and how to track and respond to the second dose drop-off.
Sure, I'm happy to take that on. And of course, my learning in this regard comes directly from our customers and from their experience using our application or using other applications if they have them surrounding our application. But generally, I think it's the flow that I mentioned. So it's starting with education to kind of engage patients with, feeling how important this is, right, to begin with. But then it is pretty much the standard reminders. Now our customers use Well, so they're texting patients for the most part with reminders, and they've, even before COVID, they had a cadence that they were using on that they would each customize to their own organization, but it was usually something like, I'm going to send a reminder 7 days in advance, then I'm going to send one 3 days in advance, and then maybe I'll send one the day before. So some of our customers during the COVID scenarios have doubled down on that. So maybe they send an extra reminder. So it's pretty easy with text. It's pretty non-invasive. It's a great way to reach people kind of where they are. So text has been particularly, I think, effective during this time. So I think that those reminders, it's a doubling down on just sort of what the standard reminders are. And then it's a very quick follow-up when there's a miss, right? A very quick follow-up to say, geez, we're sorry you didn't come in the past hour because that's when you were scheduled. Would you like to come in later today, right? It's trying to shorten that turnaround time in terms of bringing folks back in, and then doing everything that they can to make it easy for folks that missed either the first or second to reschedule. So a lot of our customers newly implemented self-scheduling during this time, right? To try, again, it's all about barriers that we talked about before, right? To try to reduce the barriers. So if self-scheduling works, a lot of folks have been implementing that just as another barrier to remove. So I think there's sort of no magic there other than to say it's a doubling down and trying to get patients to show and make it as easy as possible if they miss an appointment to rebook an appointment. In terms of unused vaccines, I haven't gotten a lot of feedback from our customers about that. I know many did start these waiting lists for people that felt that they could come in on short notice. So if there were extra doses, that they would be able to be used. I think other than that, I've got sort of anecdotal information from our customers that they have gotten very smart about storage and how to hold these things to maximize the ability for throughput, making sure that they don't take out too many of the doses that need to stay refrigerated, et cetera. So they're doing a lot of inventory management things separate from our system, but I think they've had some learnings from the early days on that. But the waiting list seems to have been very effective, and perhaps it'll be a little less necessary now that there's walk-in ability at more locations, but it certainly is one effective tool.
Excellent. Annie, I think it just shows where we are today and how far we've come, that people are leaving reviews about vaccinations, right? For COVID-19. I mean, I think, until recently, people were thankful to run and get it wherever they could. I'm curious what content-wise, what kind of feedback we're seeing about experiences, and when providers get positive or negative feedback, how should they respond?
Yeah, so we are seeing that that people are commenting. The trend is that they are commenting positively on these experiences, and I think that's largely because we've gotten a lot better with the logistics. I mean, the experience is getting better. You're not not standing in a long line. You're, even the waiting room experience for any type of visit has gotten better. I love sitting in my car and just, looking at my phone until it's time for me to go in. And so I think that those experiences are going to continue to improve. And what this means for providers is that if you are not requesting reviews today, there has never been a better time to start doing so. One of the things that I hear all the time from healthcare organizations is that the sentiment that they see or the star rating that they see on Google is not reflective of the actual experience that a patient is having. And, you can point to CAPS and say, on CAPS, I've got a 4.8 stars, and here on Google, I've got a 3. And so I don't trust that. And the reason for that is because there's not a statistically significant number of reviews in most cases. They're not getting a 3-star experience. It's that only the people who were mad went out of their way to post a review. And when you only have 10 reviews, that those few people who are upset can really have an effect on the math there. So ask everyone for feedback. Ask for a review from every single patient who has an experience with you. And whether that's getting vaccinated or an annual wellness visit, whatever the case is, make sure you're asking for reviews, because that's the only way to get enough volume of feedback to really push down some of that negative sentiment that you might have today as an average. We've seen 100% of the time this is what happens, and it's because of our human nature. If you ask me about my experience, I'm probably going to tell you that it was pretty good. But if you hadn't asked me, I'm not going to go out of my way to find you and tell you that. But if I had a bad experience, I might go out of my way to find you and tell you. And that's what we're seeing in healthcare too. And so think about that as what this future consumerism state looks like, is that we are publicly sharing feedback where the public is going. They're not going to be going to your CAPS scores. They're going to be going to Google, and they want to see feedback from other real patients who are speaking about their own experiences, and they trust that. They put more value in that and trust in that than they do on your own marketing website, because patients think that is marketing, whereas on Google, that's just information that is user generated. Other patients have provided that information. So it's a valid source, and it's a source that we need to start paying attention to and asking for reviews on, because that's the only way that we're going to make sure that consumers see the reality of what that experience can be.
Excellent. Thank you so much. Meg, one of the points where we can see dissatisfaction or frustration is when customers can get a different answer from the call center versus the live chat versus marketing versus maybe what they heard from their doctor or even their friend, who talked to somebody at the call center or something. I'm just wondering, do you have any tips for kind of breaking down silos and ensuring that messaging is consistent across channels? Because I know Well talks about this. There are so many different channels today where consumers can get information.
Yeah, you're right. That's really the mission. That's our mission, and what our CEO had in mind when he founded the company was this idea of unifying the communication, right? Because even you don't have to look to COVID to see that we're getting mixed messages, a different message from the practice than maybe you got from the billing office, and maybe you got from the front desk or the information desk when you went in, or what was on the website, right? So we're kind of everybody well-intended, trying to do the right thing. And so, Well is one of the tools that can be used to unify that messaging, right? You can customize it, but within the customization, making sure that it's standard, coming from all points within your organization is important. I think one of the things that we didn't know when we started the company was that some of the folks in communication in the provider organizations, communications or marketing, whatever you want to call it, the folks that are interested in messaging would really sort of gravitate to this idea of unifying the messaging, right? Because they've been trying to herd cats And so now all of a sudden they had an easy to configure tool that would allow them to get out the messaging. And that, I think one of the things we did learn that is very specific to COVID is that when we're in this era of evolving information and evolving tactics, we have to have tools, whether it's well or something else. So I don't want to make it a commercial, but we have to have tools that are really agile, right? There's no more this sort of set it and forget it. Oh, I've got one message about how you should arrive to the hospital, right? We no longer have that, because now it depends on if you're infected, you're not infected, the day of the week, who's at the practice, where are you headed, where are you parking, right? So everything has to be very malleable and configurable, and that's going to stay with us post-COVID, right? We need to have unified messaging, and Annie and you also, Adam, both talked about trust. And it's very hard to build trust if you're inconsistent, right? Just kind of think about parenting, right? If you just want to stay consistent and stay on message all the time, and that's the way you become a dependable partner with your patients is by being consistent. So it's super important. Well is one way to do it. There's other ways to do it too, but it takes constant attention.
Annie, anything to add to that? I know you, like Meg, you've worked in a health system environment before. Any thoughts on how you kind of bridge these different channels?
Yeah, it's really important to think about where your consumer is going to be getting that information, and whether it's they're looking for it for their child or themselves or a parent. Understand exactly what your consumer needs, and we've always done persona development, and what's my buyer persona, and what does that consumer look like, and a lot of times in healthcare, you've got this the adult daughter who is having to manage this for herself, her children, her parents, and if every time she goes to make an appointment, she's getting different information. You've got one person who's trying to manage all of this, and that can be a huge barrier to getting all of this out there. And so think about, as Meg mentioned, that this story is changing. The story changes every day. I mean, you mentioned earlier today when we logged on about the approval for even younger children to get vaccinated, and so you've got to have a plan for how you get this out there before the story changes, so that when the story changes or we get more information to educate our approach to this stuff, that the people who need that information are getting it where they are, how they consume it, and at the right time. It's the old Google tagline of right content, right person, right time. This is all about getting the most up-to-date information to the right person in the channels that they need it. And whether it's through a Google search or a text from their primary care provider or through an online chat, that has to be always the right information and the most up-to-date information. And it's difficult, but lean into technology and automation. It's not that scary. It's actually what consumers want. They want it to be easier. So I think that we're more accepting of that now than maybe we were in the past, but we've got to always think about that person receiving the message and exactly what it is that they are going to need at that time.
Well, and on that note, we just got a very good question from the audience that I'm sure a lot of leaders can sympathize with, which is, this executive told us they live in a politically polarized rural area, where some of the pushback, can be politically based, ideologically based. Do you respond to that, Annie, or do you kind of leave it? Do you have any thoughts on it? I'm sure it somewhat depends on the content, but I'm just curious, how do you handle that?
It's very tricky. One of the things that we see a lot is that healthcare systems are challenged with what is it that their physicians and nurses are saying. Do they have someone out there commenting on comment boards that can then be tracked back to the healthcare brand? And we've seen this a few times where there is a political statement or something highly divisive, or something that is about the vaccine that is not the same story that that the brand is wanting to be speaking from. And in those cases, it's really important for healthcare systems to have a proactive plan to respond to this, because it's going to come up. It's always going to come up. I have not met a single person who has worked in the provider space who hasn't faced some sort of a social media issue even before coronavirus. And so, you know, not only do you need those policies in place for what are we allowed to say as a representative of the brand while also respecting freedom of speech, but you also have to have a plan for what is your healthcare brand's position on this. Because what will happen is a consumer says, well, I saw, you know, Dr. So-and-so said this, and you know, who should I believe here? You have to have a way to say, look, we, you know, respect the, you know, freedom of speech out there, but this is why, this is what we think is the right thing to do. This is why we want you to get vaccinated. Here are some resources to schedule that appointment. We would like for you to get vaccinated, and don't go down the road of going back and forth. You simply need to prepare what you are going to say and be ready to say that when you run up against this, you know, some of that political friction. If you start to get into a well, back and forth, that's when you know you end up with these viral social media issues where, you know, the brand didn't do anything wrong, but they engaged with someone who clearly wasn't out to actually get an answer to a question. They were out to trigger a response and instigate something. So be aware that there's a lot of that out there, and it sounds like you're already facing some of that with the political landscape that we are in, and know when to not engage. It's just as important to know when to just, you know, make your statement and call it a day, and not keep going down the path, because it'll go the same way as Meg was talking about. You know, don't spend all your time on the anti-vaxxers. Don't spend all your time reacting to the conversation that outsiders might be having. Really focus on those that need the help, answer the questions that are genuine, and consider the rest to be just kind of noise that is the, you know, the percentage that you can't get sucked down the rabbit hole on. And that's what we advise all of our clients who are doing this. And you know, they've got multiple social media channels, multiple review channels, and it can be overwhelming. So it's good to have the you know, that position ahead of time before you get into the situation.
Well, and every channel has a different tone when it comes to this kind of thing. We see it on every channel, but the way it's expressed, totally different. Yeah, Meg, thank you, Annie. Meg, do you have any thoughts on this, especially when we're talking about clinicians talking to patients over, you know, apps? I'm curious if you have any thoughts on how to best handle this.
You know, I think it's all embedded in parts of the answers that we've had to other questions, right? It's about the consistency. It's about sticking to message. I agree with Annie. It's, you know, stick to what you know, what you want to say, what your own message is, and just keep fighting. I think it's very hard, you know, swimming upstream to fight against family and friends, which is also often embedded with the politics. It's hard, but you want to make sure your message is out there, so there is an alternative set of facts, as someone used to say, right? But you want to make sure that your message is out there for the folks that want to turn to your message. And I will say that you know, what we've gone through in the changes of communication channels from providers during COVID has really been profound in terms of people feeling more connected to their provider and their provider organizations. And also moving it to texting, as we've done. There's just something a bit more intimate and connected about that. It's the same way I talk with my family. I'm also, you know, talking with my provider organization. And so I think that is a mechanism to get those messages to really resonate. But I would say try all those channels, right? Try the web, try texting, try email, try portal, try Facebook, you know, try whatever, but just be consistent across all of those channels.
Excellent. And Meg, on that note, do you have any advice for rural organizations, you know, where they may where patients are going to have to travel a bit more? Is there any different way that you communicate when you're in that situation and dealing with patients who may be remote?
You know, it's always been a challenge, right? So COVID, in that sense, COVID's not new. Rural medicine has always been about folks, heroes really, willing to communicate, willing to travel, willing to bring the vaccine to various outposts, right? There's been some great stories, particularly in the wilderness areas of Alaska, of nurses that are really just true heroes in terms of driving thousands of miles to try to get to sort of centrally located small church to serve, you know, a community of 20 or whatever. I don't know of a better way than to continue to distribute it that way. There's some exciting science, you know, so maybe next time will be great. There's some, you know, great stuff happening. People are experimenting with transdermal vaccines so that, you know, basically you'd be able to mail somebody a patch and they could put it on their arm. So there's brighter days ahead, but until then, I'd say thank goodness for those people that are really doing great work for us.
I didn't know that. That's fascinating and interesting, and definitely could do a lot. So I want to ask one more question to both of you, and this has been fantastic. I wish we had more time. But you know, in addition, we've talked mostly about the adults today, but just yesterday, vaccination eligibility expanded within pediatric populations. So yesterday, the FDA expanded the emergency authorization for Pfizer's vaccine to include 12 to 15-year-old children. And so that means that the vaccines, that Pfizer's vaccine at least, is going to be available to anyone 16 and older. We've gotten some questions already about, you know, how do you even just deal with the 16 to 19-year-old population? But I'll ask you generally, what should providers do to start planning for more pediatric outreach, or outreach to you know, for pediatric patients, I should say? And are there messaging strategies or communication channels that you think are going to be more ideal for this patient population? Annie, I'll start with you. I know social media could really be a player here.
Well, I'll tell you, the answer is not to go out and do a bunch of TikTok videos. I don't think that's not going to be the best use of your time. But you know, I mentioned it a little earlier about that the adult caregiver, you know, that the mom. I mean, as much as you know, we want to appeal to the parents as we can. You know, if the parents are getting vaccinated, when the parent even schedules their appointment for the vaccination, that could be an opportunity to say, hey, you know, would you like to make an appointment for your kids as well? You know, if you've got you know, more of a vaccination clinic style where people show up and that's the only thing that you're doing there, that could be a great way to adjust your messaging and say, you know, bring your kids in, bring the whole family, come on down, we'll get you all vaccinated, and you know, treat it the way that you would treat any other kind of expectation. You know, we know that kids are going to go back to school for kids are going to need a physical to go back to school. That's an annual thing. You know, every year we put out these campaigns around back to school physicals, come in and get that. This could be just part of that campaign. You know, come in for your physical, and your vaccination will be part of that. Don't make it an option. Don't treat it as this like separate this other thing. It should be treated as this is just a normal way of life now, and your kids are going to be part of that that move to be vaccinated as well, and it should be built into our behavior. You know, the targeting, again, that persona that's going to be making that decision, I think is the best way that we're going to get all of the young people vaccinated.
Excellent. Meg, I'm going to give you the last word. What do you think? How do we reach out to pediatric patients?
Well, I'll focus on those 12 to 15-year-olds that are newly eligible. And I'd say, you know, yeah, the messaging is, I believe, to the parents or to the responsible adults. And I think they'll make this decision as they make all their decisions for their kids, right? Part head and part heart. So let's educate around the science, and let's engage their hearts around future and where they want to be able to see their children grow to in the future safely, and start families of their own, et cetera, et cetera. And yeah, head and heart, always head and heart.
What a great way to end it. Well, thank you, head and heart. So, folks, that takes us to the top of the hour. It's time to conclude the webinar. Thank you again, Meg and Annie. What a great conversation we've had today. Our audience, we value your time and feedback. Take a moment to fill out our brief post-webinar survey. Modern healthcare, reputation, well health, we all want to know what you thought of this webinar so that we can all provide the best content and resources for you. So make sure to take that. We'd like to once again thank the sponsors of today's webinar, Well Health and Reputation. For more information about both of these organizations, you can visit the websites on our screen. This webinar will be available on demand, and a copy of the slides and a link to the recording will be available to webinar attendees within the next 48 hours. This concludes today's presentation. Have a great day. Thanks, Annie and Meg.
Thank you.